What's on Your Minda contains honest, intimate, and uncensored depictions of mental health issues and experiences. Content and trigger warnings can be found in the description for each episode.
Welcome back to another episode of
What's
What's
on
on
Your
Your
Minda?
Minda? What is on our Minda today, Diana?
For me, it's my job,
Hmm,
particularly about being a clinical psychologist.
yeah.
Do you mind sharing what is a clinical psychologist?
Well, a clinical psychologist, as far as I know, being a clinical psychologist myself, is a profession or a mental health professional that deals with clients of varying levels of severity. We are able to do clinical assessments and give diagnosis for mental health disorders. And I think that gives us a bit of a difference with psychiatrists and counselors. What do you think?
Yeah, definitely. Where psychiatrists they do as well diagnostic evaluations, but they also prescribe medication,
Yeah.
and some of them also provide psychotherapy, although it's not common.
Yeah.
And counselors essentially provide counseling, and some common screening services rather than a full-on assessment, a psychological assessment or diagnostic evaluation. And I know I'm saying a lot of these terms. It's like, what even is that, right? Also, what even is that? What is a diagnose? What is a diagnosis? What is psychological assessment?
Mm.
Like,
Yeah, we got to clear these jargons up
oh
for
yeah.
the audience. I think when you think about an assessment or a diagnosis, it's sort of like taking a test, and then the results at the end of the test is what your mental health status or condition is.
Mhm.
So there are so many different types that are made particularly for figuring out if you have a certain mental health condition or a disorder.
Yeah.
Like say for example, there's a bunch that's geared towards intelligence testing that
Mm-hmm.
helps you know if you have any, intelligence or developmental related issues.
Yep.
Yeah.
So some common developmental issues would be autism or ADHD,
Mm,
or even those who have learning disabilities or developmental disorders.
and I think like something to just make sure that we can clarify for people, because a lot of people will always ask me this, is if we can prescribe medication,
Mm.
and we can't, right? Because the ones who can prescribe medication are psychiatrists, and that's because they went through a medical degree first. So they're doctors first, and then they specialize in psychiatry,
Mm.
which is treatment of mental health or psychological health after that. So that's why they can prescribe medication, and we can't. But we can refer people, we can refer clients to taking medication.
True. I want to ask, what's the best way, like one liner, for why should people see you or see a clinical psychologist?
Oh my gosh, you're putting me on the spot here. Let me craft something up. A one liner. If you have something more severe than life changes or transitions in life, and something that you are not ready to get medication for,
Mm.
maybe come to a clinical psychologist first.
Yes, I agree.
Is that all right for a one liner?
That is. So, and it's also, to add to the one liner would be that it won't be a one off. So, it is going to be more of a long term commitment,
Yeah.
than just like a one off counseling. And to um, emphasize that if you're not ready for medication or if you want to do both.
Yes, exactly.
From a client standpoint of view, right?
Hmm.
Let's say you're experiencing certain issues. What would be those issues that you think, I should go see a clinical psychologist?
Mm. Some of the common issues or concerns could be like depression, anxiety, stress, or even burnout at work.
If you're feeling like you want to kill yourself, come to us.
Yeah,
If you
suicide.
feel like living on a day-to-day basis is incredibly tough, and getting up is like dragging, I don't know, tons and tons of weight on your shoulders, come and talk to us.
Yeah.
If something traumatic happened to you and you have not spoken to anyone about it, come to us.
Ooh, look at that blurb. I'm gonna cut that out and make it real.
Yeah. Come to us.
Come to us.
We essentially work a lot with thoughts, emotions, behaviors, just all the internal works and being a human.
Yeah.
So with that, maybe you can share with us, what do you think about how the mental health scene is in Malaysia today?
Well, I think there's definitely some changes over the years compared to maybe a decade ago.
Mm,
But still, I think the mental health scene is very, very small.
mm,
We do not have enough professionals especially in like the government setting.
yeah.
We've got a lot in the private setting, but I think that's also because there's not as much space created for us in the government setting either. So that's where I think the scene is limited because opportunity or resources are limited.
Agreed, 100%.
Yeah. And it's so new, right? I feel like it's still considered so new. We just had our that ACTA approved passed a few years ago.
Mm-mm.
We're babies in
We're fetuses.
in the world. Mental health in Malaysia is like a baby,
Yes.
right? So it's definitely very limited. It's very new, and I think that's why for us especially, there's a lot of work to be done to like make it accessible to people, because a lot of people don't even know what mental health is.
Yes. And I think, just as you said that, right, it really opened my perspective of not understanding what mental health is, or what it actually looks like. So last time I always thought it was very cognitive level, like, oh, I don't know, I need to differentiate the true clinical or technical definition of mental health and mental illness, and everyone should be thinking that way. When I realized actually not understanding what mental health is not understanding your own emotions, not understanding
Yourself.
yourself, and what your body is being triggered by, what these senses are, what they actually mean, or when someone says something to you and you have a visceral reaction, that you are aware of it, but you don't have the words to articulate what that is.
Yeah.
That is not understanding what mental health is.
Yeah. And I think that's because nobody showed it to us.
Yes.
To the general population, we don't know because we don't see it anywhere. We don't see it depicted in like our schools.
Yeah.
You know, we don't see it depicted in our parents sometimes, most of the time. And we don't see it even in our media. I mean, yeah, if we consume Western media, it's there.
Mm-hmm.
But we can't say that everybody does.
Yeah.
And the people who don't, where can they find these depictions?
Exactly.
How do they realize, like, okay, these are emotions and this is anger, and I should be doing this for healthy expression of anger, but instead I only see my dad yelling at us when he's very, very angry. So I adopt that.
Mm-hmm. Agree.
So resources,
knowledge,
accessibility.
Knowledge is key, which is why it should ideally be taught in schools.
Ideally,
Just the whole, and I don't think I believe it's not a subject to be taught. It's more of a value to be integrated. So that shows in teachers, and what's tolerated in schools. How do we talk to each other?
Yeah.
And I believe that if we embrace our emotions, we also embrace kindness, and we embrace empathy and compassion, and boundaries, and respect. So many things.
So many things.
So
And I think even particularly for us being in Malaysia, as an entire cultural community becoming even more segregated now,
Mm,
which is sort of the opposite of what you'd feel, progress would be.
yeah, agreed. Well, what do you think contributed to that?
I think it's definitely lack of knowledge lah. Because in a way, what is keeping people segregated? Like, what is it that happens there? It's because, are we saying this? Because the leaders are sort of showing us how to be, right? We're following the lead
Yeah.
of what's being shown to us. And even more now, especially now, I think there's a lot more segregation happening because there are people in power who try to enforce that
Yeah, agreed.
in our culture, in our communities.
Which also makes me think that as much as we want to separate mental health from politics, it's very integrated. It's mental health
Yes.
in Malaysia is very much politicized.
Yes. Yes, exactly. I didn't know we would come here, but we came here.
Yeah.
And for a good reason.
Yeah.
Because who are the people who are passing these bills of like decriminalization after people have suicide attempts? People in power, right? The leaders. So it's such a sad world to be in where a mental health or the impact of mental health on someone can lead to them not getting help but getting jail time.
Yeah. It's being seen a, as a crime that needs to be punished rather than a cry for help that needs support.
Yeah.
And it's really, really, really heartbreaking. Mental health is more integrated into politics, or it's more involved in politics than we hope,
Yeah.
or I would naively used to think about. I used to think, oh, it's not it's not being politicized at all, which is absolutely false, Diana. Absolutely false.
Uh-huh.
Very naive. Because if you really think about it, it's a lot of things are impacted. Accessibility, and what accessibility means is huge.
Yeah.
It's, do we have budget to hire more clinical psychologists? Do we have budget to send more students to continue on their masters and get maybe financial aid to continue their education and training? Do we have enough supervisors who are trained, and able to not be so overwhelmed and burn out with too many supervisees, right? Do we have training sites, practicum sites?
With enough clients so that these trainees can actually get the experience that they need.
The tools, right? As psychological tools, are they being invested and bought and purchased? Is it prioritized to be purchased?
Exactly.
And I've heard stories within my own practicum experience where patients or clients from like the opposite state coming all the way to the current state I was in because their nearest hospital didn't have the tools.
Yeah.
And and the tools that we have were not necessarily the most latest tools either. So, but it is what we have to make do with what we have, right? Because that shows how there's not much funds going into the mental health sector and industry in Malaysia, particularly, especially as a whole, even within the private sector, right?
Yeah.
So,
and I mean, there's a reason for that. That's why we keep talking about politics and how much of an impact it has on mental health in the mental health sector, because there's a choice there of how much budget to allocate to this.
yes.
And it doesn't seem to be necessary or prioritized compared to other areas.
Yep, agreed.
So I guess like with that, with what you just said about your hospital experience as well, I think in the previous episode we mentioned that we have very different practicum training experiences.
Yes.
And so I'm sure I am, and the other audience would also be really curious to know more about these different experiences and how we have come to the same point, but we started at very different places.
Oh, I like how you Oh, you said that. You know,
Thank you.
we really did come from different points.
Yeah.
And we are at the same place now. Okay. Yep. So, I started out at the hospital, government hospital, mainly because I went to a government university. So we had a our own hospital. So I went for practicum there. It was really a enlightening experience. I enjoyed it because of the variety of people I get to meet and cases and issues, severity levels as well. Um, so yeah, and then I from there I also had the experience to work at an NGO. After that, also had exposure with a new group of population, mainly the B40 people community. Sorry, and um the marginalized communities who are victims of domestic violence and um, refugees, right? As well as then I got to work in a startup that worked mainly with the working population. So it's been a variety, but particularly within my practicum experience, that was essentially it for me. And I understand it's a bit different for you. How was your journey like for your practical?
I think like what similarly to what you said, where you started in a government university, which is why you went into sort of government practicum training. I was in a private university, so a lot of these sites were private. We had maybe one or two hospitals, and it was very rare to be able to get a hospital experience because it was so limited. I think in 1 year, maybe you'd get 4 spots
Yeah.
and like a class of 15, for example. So everyone else had to go into private. If you really, really wanted to do a hospital experience, you would wait until that's available or try your best to get into that. I think for me, it was not something that I was very interested in to go into the hospital experience, mainly because I sort of saw myself in the private sector anyway for a very long time. So when I went into the private sector, it's also interesting because you get to see the kind of cases that, you know, these are people who can afford therapy services or afford the higher end of therapy services, the price point of it. And it's also interesting because I had a client who came from a different state because there was a private experience here in KL that they couldn't get in
Yep.
their state,
Yeah.
right? And they couldn't wait for the government services to be available because all they had back then, I think they didn't even have a psychiatrist back then. So they were coming to KL to get psychiatry services as well as a therapy service,
Understand.
right? And even then, like for us, our practicum fee or sorry, our therapy fee for trainees were very low. But still, compared to some people who can't afford even 50 ringgit, it's a lot.
It's a lot.
Not everyone can afford that.
Yeah.
So, sort of training in that, I could see that when you're in a private sector, you have to do things yourself. Like the place I was with, they bought the the intelligence test, which by the way is like 20,000. Is it ringgit? Yeah, about 20,000 ringgit, just so they could use it because they're not getting this from anywhere else. Like,
Yep.
they have to purchase it so they could use it, and so it's interesting that I had that sort of different experience where we learn very similar things in very different ways. Right? I think we did talk about this before where when we talk about what was the topic you mentioned there, like my supervisor didn't like tell me about it. Something about the way you do therapy.
Yeah. Therapy style?
I think so.
Timing? How do you actually start with therapy? How do you
The-
actually do it?
Now, how do you like stop the timing?
Timing. Yeah. The timing. The ending of therapy.
The ending of therapy, right?
A
That
session.
one. Exactly. So there was some things that I would get from my supervisor that, maybe Diana didn't get from her supervisor because it was a hospital experience.
Yes.
And there's something that she would get in the hospital experience that I didn't get because I was in the private sector. I didn't see many severe cases. The most severe I saw was maybe someone with a combination of body dysmorphia and OCD. right? And even at that point, I didn't even see any BPD clients,
Right.
right? But what about you? What was your most like severe case in the hospital?
I met clients with OCD, both child and adult. I also met a client with panic disorder,
Yeah,
and as well as what do you call that?
BPD.
BPDS, borderline personality disorders.
Did you see any clients with like more severe conditions, maybe like schizophrenia?
We didn't.
You didn't.
No. However, I did meet a client with schizoaffective. Yeah.
Yeah.
But how the client didn't show up for the session.
Okay, well,
The client didn't show up.
now that's something that we can relate to in the private or the government
Yeah,
sector.
it doesn't matter. That is a common theme.
Common theme. Everyone will experience this.
Yes.
Client don't show up. But no fault of theirs. I think again there's something there when we talk about accessibility, knowledge, even insight sometimes with
Yeah.
themselves and their mental health.
Yes.
And it makes it hard for them to even go through with therapy services. So that's our experiences. And then we ended up in the same startup.
Mm-hmm.
We met at the same company later on. And
Yes.
so it's sort of weird that we came from such different experiences and then ended up here, right?
Yeah.
And from there, we were like, hey, we want to do something on our own. We want to have this space where we want to focus on accessibility, affordability, but also knowledge and resources.
Yeah.
And that's why we're also doing this,
Yeah.
because we want to show all of you what's behind the scenes, the things that you don't really get to hear about when you talk about psychology or clinical psychology and mental health in Malaysia, especially.
Yes. What do you call it?
Snaps. Yeah. But with that, is there anything else you would like to tell a budding clinical psychologist?
I would say I'm imagining my old self starting out. So just a bit of context, how I would describe her. She's very bright-eyed, excited, eager, driven, motivated, bit of a type A, also rigid. And I'm gonna reiterate what my dad told her, which is manage your expectations. It's exactly what I needed to hear. It's exactly what I needed to hear. Because honestly, in this industry and in this career, it's a lot of self-driven, self-drive, because you will face a lot of some difficulties. What I mean by difficulties is you're gonna deal with stigma, and stigma is a huge thing, and stigma is not talked about as much as well, right? How everyone would question your role at some point. Okay,
Oh my God.
your parents, the old people, even your employers, right?
Yeah.
Like, why should we hire you? What can you contribute? Why you? Why not the counselor? Why not the psychiatrist? And then even clients with themselves, like, oh, is this really working? And constantly being faced with stigma, right? And even yourself, oh, am I doing enough? Is this enough for my clients? Am I contributing? Am I keeping myself on track and so forth? So sometimes it's gonna be a bit rocky and choppy, and you gotta do things from ground up. You gotta buy your own tools. You gotta set up your own space, drive your own self to initiate things by yourself. You need hours. You need to collect your hours, create a webinar, do talks, give talks on a specific mental health topic that you're interested about. So you need more hours. Market yourself, market yourself, share about the services that you're providing. It's really about self-driven. If you're hoping that things are handed to you, probably not. Not right now, at least. I wish I could just hand it to you and be like, all is well done. You just gotta show up and just do the basics. No, it's more than that. I would say manage your expectations.
That's a good point at the end there, where if only we could give that to you. But I also feel like if we give it to you, it will not help you develop as a therapist or as a psychologist, because I think the fact that we went through such strife and such a struggle, honestly, but because we went through things like that, because we went through more and more of people questioning us and questioning ourselves, and then finally finding support and finding a way to ground ourselves and trust ourselves, that's what brought us to where we are here.
Yeah.
So just jumping off of your point, I think something that I would like to say to aspiring clinical psychologists out there is go through the struggles. It will help you later, right? But as you go through it, make sure you have good support, you have good self-care, you've got good boundaries. If you don't, maybe you can also invest in yourself by going through therapy. And now that's a topic for the next time.
I'm so excited.
We'll address that next. But thank you for listening to us talk about being a clinical psychologist in Malaysia and mental health in Malaysia. I hope you enjoyed this episode. Please let us know if you have any other questions or any other topics you want to hear about. You can reach out to us through our email. It's all in the description. Or you can just send us a DM on Instagram at Minda Psychology. Yeah.
Thank you.
Thank you. See you next time. This has been What's on Your Minda?